So, what is glaucoma exactly? We will start by talking about how we see the world. First, light has to enter the eye. Once in the eye, the light gets converted into signals by millions of mini cameras. Then, the signal wires deliver the signals from the eye to the brain. The brain then interprets the signals to create the images in our minds, allowing us to see the world. If there is a problem with any one of these steps, we can have blindness. For instance, we've all heard of cataract. This happens when the front window of our eye is not clear, and so light cannot get into the eye. Millions of mini cameras in our eyes are called retina. When there is a problem with the retina, light cannot be converted into a signal. Some of the common problems of retina are due to macular degeneration and diabetes. The individual signal wires combine to form one big bundle of wires. This bundle is called an optic nerve. When there is a problem with the optic nerve, the signal cannot be delivered to the brain. This is how we lose our vision from glaucoma. So, how does glaucoma damage optic nerve exactly? Our eyes are amazing organs. Instead of blood, inside of our eyes are filled with clear fluid. This is so that light can get into the eye without scattering. But just like blood, this clear fluid constantly flows in and out of the eye to bring nutrients and also to remove the waste products. In glaucoma, the drainage system for the clear fluid is clogged, and it gets even more clogged with time. As a result, the inside of the eye is filled with even more clear fluid. This makes the eye more firm, meaning that the eye pressure is high. The high eye pressure is harmful for the eye. Most importantly, this seems to damage the optic nerve and cause vision loss. Eye doctors can look inside our eyes and determine how healthy our optic nerves are. The optic nerve looks like a donut since it is circular with an empty space in the middle. Specifically, doctors use the term cup-to-disc ratio to describe how big the empty space is compared to the whole optic nerve. For instance, in this picture, the empty space is about 30% of the entire optic nerve in height. Normal cup-to-disc ratio varies from person to person. Looking at the size of the empty space is important because it allows the eye doctors to see how the glaucoma is doing. When the optic nerve gets damaged, the empty space gets bigger, meaning there is less amount of healthy tissue left. So the doctors would say that the cup-to-disc ratio is increased and that they are concerned. Now, here is a very important fact you need to know. When we get a cut in our skin, it heals magically. New skin replaces the old. However, there is no healing in optic nerve. It does not regenerate, so the damage from glaucoma is irreversible. The parts that are damaged stay damaged permanently. Again, the damage to the optic nerve is permanent, and this means that the vision loss from glaucoma is permanent too. Permanent. There is no second chance to improve the vision. As hinted before, glaucoma is a silent disease. It is similar to aging. Each day we get one day older, but we feel exactly the same. In glaucoma, the vision loss starts from the periphery and gets worse slowly, day by day. Most people pay attention to their central vision and are not aware of the vision loss from their glaucoma until it becomes quite severe. And this is problematic because if you wait until then, you have lost a lot of optic nerve tissue, and that damage is permanent. The best thing you can do is to get a routine eye exam and catch glaucoma early and start treatment right away so that you can prevent the damage from happening in the first place.